Hey guys, how we all doing? Welcome to my channel. My name is Violet Okolocha, and today we'll be doing something a bit different. Just because a lot of people have passed their OSCE exams and they are like, sometimes I'm not passionate in my new role. This is not what I actually wanted to do or what I've been doing before. So what do we do? So guys, today we'll be going to be inviting a very passionate nurse who is passionate about his current role and will be sharing with us some ideas of how he got to his new role. So guys, put your hands together and let's invite Nurse Francis Asabare in the house. Francis, you are highly welcome. Please have a seat close to me. Thank you so much, Francis, for
You're
coming.
welcome.
I really appreciate it.
It's
So
my
Francis,
pleasure.
are you happy for us to start?
Sure.
Okay, so could you introduce yourself, please?
Yeah, I'm Francis. I'm from Ghana.
Okay. What's your surname, Francis?
Yeah, it's Asabri.
Okay, so you're Francis Asabare
Yeah.
and you're from Ghana.
I'm from Ghana. Yeah.
That's beautiful. So how long have you been working in the UK?
6 months, 1 week. Yeah.
Okay, that's perfect. So what trust do you work with?
I work with East Kent Hospitals University.
Okay.
The trust has 5 hospitals, so I'm at QEQM.
Wow.
Queen Elizabeth, the Queen Mother.
Okay, that's good to know. So Francis, where were you posted initially when you joined the trust? What unit or what department were you posted when you joined the trust?
Well, when I had the date for the interview, I told them I wanted to go to ITU.
All right.
Because I was an ITU nurse back
Okay.
home. But then they told me there was no vacancy. So the best department for me was for me to go to theaters
All right.
and wait for a vacant place in ITU.
Okay.
So when I came, I was in theaters.
So when you were in the theaters, do you feel really supported and confident in carrying out your roles there in the theaters?
Well, I wouldn't say I was fully supported
Okay.
because I didn't have any theater experience. And you know, moving from Africa to the UK is a bit challenging.
That's
because
right.
here the systems are different.
Okay.
No one will really get the time to teach you everything. But I mean, with my line manager who was very supportive from day one,
It was easy.
Yeah, it was
Okay.
quite easy for me to sell.
Okay, so how did you move from the theater? Did you send an email? Did you go through job advert? Because to be honest, a lot of people say if you're not supported in your role, or rather you're not passionate about your role, you know, as a theater nurse or whichever field you find yourself, probably you're in the cardiac unit, you're in the theaters, you're at the AMUA unit, and you know, you're not passionate about it. You may be supported, quite all right, but you're not passionate about it, then you should go through job advert and check for the job advert, apply directly, and you could have a change. So was that your case?
Well, initially I'll say it was because I had to go through the hospital's intranet where they publish, vacancies. So I had to go through it, search for an ITU vacancies. I didn't find any. And when I came to the UK, I didn't have my PIN. You know, I had to write my OSCE.
Yeah.
So after my OSCE, before I had my PIN, and I had like the RN title on me.
Yes.
So actually, I had to wait, and my line manager was very supportive from day one. So from day one, I told her I wasn't happy at the theater, so I wanted to move to ITU. So I think from the first day I told her, she told the ITU matron that.
So there was a communication between your matron and the ITU matron.
Yeah, definitely.
She was really supportive.
She was really supportive. She was really supportive. From day one, she was really supportive. So she informed the ITU matron that there's someone who is really interested in coming to her unit. So if there's a vacancy, she should let her know.
Okay.
So I had to wait for about a month, and God being so good, after the month, there was a vacancy.
Wow.
And she told me, and I gladly, hope to the opportunity, yeah.
Okay, so the moment she told you there was an opportunity, was it that moment you started your job in the ITU department or the intensive care unit rather department?
Well, there was no time to waste. This is what I always wanted. So when she told me, I said, yes, I can start on this very day, if you don't mind.
You see, guys, so when you're passionate about your role, you feel confident. So Francis, so far in your role, how confident do you feel? Because now you've left the theaters where you felt it was not something you love to do, and now you are in the intensive care unit. So have you ever took a challenging role so far that you're able to prove that I have the skills and I have what it takes to be skillful in this my new role?
Well, I would like to say this thing. If you and you are working in the UK or anywhere outside your country or your continent, there's this prejudice that's always there.
Okay.
They always think you don't know enough, so they'll push you to the wall. They'll give you the most challenging things.
Okay.
But once you prove them wrong, then you start earning their respect.
Okay.
You get what I mean?
Yes,
so,
I guess.
yeah, when I started, it was like, they didn't even think we had ventilators back in Africa or back in Ghana.
I can imagine.
Yeah, I mean, that was a horrible idea for someone to think there are no ventilators back home. Do you understand?
Yes, I
do.
do.
But I mean, once you start showing them what you actually know, once you start telling them, or once you start showing them what they even don't know,
yes,
then they start
respecting you. You know, they hold you at a very high self-esteem.
Yeah.
So at present, you are confident with your role.
Well, at present, I'll say I'm 80% confident. Because,
wow.
You know, UK is a lot of paperwork,
yes,
a lot of machines, and even the slightest thing, you have to write a paper or you have to document, and at times it's really annoying.
What can you do?
Yeah, for formality.
Yeah, to be honest, Francis, I really see from all you said so far, I see how happy you are in your role, and your happiness really affects your mental ability. It affects the way you function. So hopefully you'll be able to function like 100% now, just because you are happier with your present role and you already had the skills back from Ghana. So I just want to ask you 2 questions before we round up this session. A lot of people say there's a clear career progression in the intensive care unit compared to any other unit or department in the nursing field. How true is that? Is there really a clear career progression, or rather a clear career pathways in the ITU, the intensive care units?
Well, I would say there are a lot of specialties in, UK RN.
Okay.
And ITU is one of the most, I would say, prestigious specialty.
Wow.
Yeah, it is. Yeah, it is. Any ITU nurse will attest to the fact that it's one of the most prestigious specialties. And for where I am, for my trust, if you spend about, I think, 2 years, they can sponsor you, if you have your degree already, to do your master's in intensive care. So that's like a clear
career progression, a pathway rather.
Yeah, yes. They sponsor you to go.
To be honest, I started respecting the intensive care unit when I faced this scenario. I had a patient who felt really very poorly on the ward, and I put that patient on 40% Venturi. And you know, I called the doctor and he was like, I'm coming over to attend to the patient, but you could call the outreach department. I never knew for sure that the intensive care units run an outreach department. And when the outreach nurse came, the way she attended, you know, the way she managed the patient, I was like, oh my God, these people are skillful in what they do. So since that day, I hold the intensive care units at a very high prestige, and I respect anybody who works there, because I feel, you know, they're like on top of their games. It's just because I don't want to start all over again. That's why I'm like, oh, I'm okay with me. I work for now, because I'm really afraid to pick up challenges at the point in my life now. So Francis, it's really good to have you on this channel. So what's your advice? What's your advice generally to nurses who may be in the Ghana, who may be in Africa, who may be anywhere, or probably the Filipinos, and they're like, I want to come to the UK, I want to come to work as a nurse, probably in the ITU, which is the intensive therapy unit, or the intensive care unit, or the cardiac unit, whichever. What's your advice to them?
Well, I have just one short advice. The thing is, relocating to the UK or to anywhere else is very challenging. And I think one of the most challenging thing will be working at a place you are not happy at. So it's better to follow your passion, follow what you really want to do. If you know you're not happy at your current unit or your current department, just let your line manager know and change it. Because trust me, if you're not happy at where you are, relocating to the UK is not going to be a happy ending for you.
That's right.
So just follow your passion, be passionate about what you do, just love your work, and life will be okay, life will be better for you.
Wow. Yeah. So you've heard Francis. If you're not supported in your role, or probably you're not passionate about your present role, guy, please email them and go to somewhere you feel passionate about and somewhere you are happy about. Don't die in silence. Speak out, voice out. And Francis, sorry, there's something I wanted to say. Yeah. You know, a lot of people complain of this transition from band 4 to band 5, you know, like before your OSCE exam, probably you're in band 4 or you're in band 3, and now you're coming in after your OSCE as a band 5. Yeah. Is that really a major challenge? Because a lot of people feel that I still feel as if I'm a band 4 even when I'm now a band 5. Did that affect you at any point?
Well, I would say it didn't really affect me because when I changed my unit, I had already written my OSCE. I was just waiting for my pin.
So you were there as a band 5 full-fledged
I was there as a band 5, yeah. And one thing in ITU is we don't have a lot of band 4 or healthcare support workers.
Okay.
Because we do, like, any ITU nurse want to do everything
by themselves.
Exactly. So
they are so
we must have the
independent.
patient. Yeah. I mean, I work with, I think it's 1 or 2 healthcare assistants in a day. I don't even see them. I watch the patient myself.
Oh,
do you understand?
bless you.
Yeah, because it's like you have this one patient and you are so responsible for him or her.
So each
you
duty, I'm sorry to cut, each duty you manage just one patient.
Usually it's 1. Occasionally, if you are short of staff, you get 2.
Oh my God.
So it's like you have so responsibility.
I think I have to start thinking to come to ITU because I manage a whole lot of patients.
Yeah, I mean that's the thing. I always tell myself there's no way I'm going to survive on the world. Do you understand?
Yes.
Because there's no way I'm going to do formally ops for a patient. Where I am, I do it almost every second. I'm always watching the monitors. So I go to the ward, I'm managing 12 patients. I have to do ops formally. And I'll be there, I'll be thinking, so what's the ECG like? What's the saturation like? Do you understand? I have to wait for 4 good hours before I know my patient ops. I mean, I'm never going to survive on the ward.
Oh God, Francis,
Yeah.
I'm super excited and I'm super proud of you. Thank you for coming to share your experience with nurses all over the world. It's really appreciated, and I promise you this week you're going to have fun all through. So thank you very much, Francis. Highly appreciated.
It's my pleasure.
So guys, you've heard from Francis. Please and please, I want every one of us to be happy with what we do. Even if you are supported and you're not passionate about what you do, guys, have a routine. Email them, email your line managers, have a word with them, and probably go to where you are passionate about. Life for me is all about passion. It's all about what you love to do. So guys, thank you so much for watching. Please don't forget to subscribe, and don't forget to share this video with your friends who are also nurses or who are aspiring to be nurses. So I'll see you in my next video on Peak Flow Meter, and until then, keep passing your OSCE. Bye guys.
Bye.